question coming in, how can I tell the difference between normal stress related to the job and distress in a colleague that would require intervention? Where is that line, and what are best practices to find it? Carolyn, do you want to start with that, and then maybe Mark, your perspective as well?
Sure. Well, again, as I've talked about, sometimes it's a significant change in behavior. Somebody is a little quirky or has their own idea of things or conducts themselves in a certain way, and that's now a change. It's heightened, it's more aggressive. It's very different from what we're used to seeing. And of course, some of that will depend on how long we know the attorney. For an attorney who's been with a firm for years, certainly we could identify a change more easily than somebody who has just come to work for us or somebody who has only been there a matter of months. And now with virtual work, in addition to in-person work, it makes it that much more challenging because we don't see the person all day, every day. So we would look to what's a significant change, whether that change represents some sort of danger or risk of harm. And we would have to look at each individual situation and each individual attorney to make a decision as to whether this is just somebody going through a bad time or lost a case or has some sort of family issue versus something that's much more serious than that. I would suggest you talk to your HR people or any other clinical people who may be involved with the firm, or you could reach out to run by them whether this is in fact something we should be at heightened concern about, or it could be the softer approach, or it's just a one-off. And again, looking at those red flag behaviors and balancing and weighing how far from one side to the other it goes.
Wonderful. Mark, any thoughts from you?
Yeah, I think one of the things to be alert to is that when people get to a level of stress or anxiety that's either beyond the norm or beyond their sort of expected behavior, look for what I call signs of seclusion. And Carolyn referenced this in her presentation. And that's when someone really shows little energy or capacity to participate in group discussions or practice to discussions, tends to be shut off and isolated, starts to say very little about their family or their personal life. And you kind of notice at meetings that they seek to make themselves small, almost like during a crowded hallway at a high school, they're trying to slip out the door sideways and have no one really notice them. Those signs of isolation are huge, and feelings of isolation are a huge contributor to the general mental health crisis in the legal profession and causes of depression and anxiety. So when someone who's normally an active participant in firm sporting events or firm events or a frequent contributor to committees and projects begins to withdraw and starts to really, add not only very little to the discussion, but almost pull back as a way of not being seen. I think those are some really good things to keep an eye out for. Because as people begin to slip into depression, they begin to want to be unseen.